When we talk about mental health, it's really easy to just think about labels and diagnoses, as you see here. But at the heart of it is people. People you know, people you love, people you work with, including yourself, who have been touched by mental health challenges and mental illness. I would like to get started tonight by sharing my own personal story with my family's permission about mental health. So here's a picture of me and my brother in 1978 in all of our glory fashion, enjoying my first day photo for kindergarten. Just 6 months earlier, after feeling fatigued and out of breath, upon a routine medical exam with my physician, it was determined that I had a heart murmur. I would be quickly transported from Cranbrook down to BC Children's Hospital, where I would have a team of professionals, including nurses, physicians, and surgeons, and all the care aides who worked together to give me the life-saving surgery that I needed. I was able to go back to being a 5-year-old kid. But at the same time, our Auntie Betty, pictured here, who we were both very close with, started to struggle with mental health issues. Unlike me, she did not receive timely access to assessments, to diagnosis, and to evidence-based treatment interventions. Instead, she languished. And despite our best efforts, sadly, 20 years later, she would take her own life. My aunt died because currently in this country, patients do not have access with the same urgency and focus and precision about getting patients the assessment, the diagnosis, and the treatment that they need to survive and to thrive. So let's just start with one thing to start with, and that is talking about public funding of mental health specialists such as psychologists. Psychologists are not a covered provider within our publicly funded system, creating an access divide to mental health providers, including specialists, counselors, social workers, and other important critical members of mental and behavioral health teams. And then there was deinstitutionalization. Shuttering people away in large institutions was no longer the best approach, given the harms that were being done. The institutions were to close down, and the promise was that funding would shift. But the reality, however, was very different. Instead of reinvestment, resources were simply reduced, leaving even further critical gaps in care. So let's be clear about the statistics. 1 in 5 Canadians will have mental illness this year. 1 in 2 of them will have that diagnosis by the age of 40. And then there's suicide. Suicide is the second leading cause of death in this country among youth and young adults. And that is only eclipsed by the number one group dying by death by suicide, and that is middle-aged men. Currently in this country, patients with mental health disorders and distress are essentially left to their own devices, asked to coordinate their own care, and even more, asked to pay for it. I'm so excited to turn over to my colleague, Dr. Harry Miller, who will talk about our program.
I have the distinct privilege of being able to talk about our amazing UBCO Psychology doctoral clinical program and the psychology clinic. Clinical psychology students on their way to becoming psychologists are uniquely trained in the ability to deliver treatment and intervention. If you consider our program that started in 2013, we've had 26 graduates. Of those 26 graduates, 5 have remained in Kelowna, and they're either at Kelowna General Hospital or taking positions in community mental health. So they stayed in Kelowna. We have 14 of those 26 students who have taken positions in British Columbia. Okay, I want to move now to talk about the psychology clinic. The psychology clinic is instrumental to the clinical psychology program. It provides supervised, evidence-based, affordable, and accessible care in terms of psychological services for those in our community. Students in our program are required to do leading-edge research. They are required to do research that's peer-reviewed and published in reputable journals, in world-class journals. And so you can see here, this is just a smattering of the papers that our students have published. This type of research is what supports the day-to-day practice of psychologists, not just within our walls, but psychologists all over the country and the world.
My name is Alana, and I'm here to share a little bit about psychological assessments and why they're such an important part of mental health care. An assessment essentially helps us understand how a person thinks, how they learn, feel, and behave. And we do this by gathering information from a number of different sources. The key point here is that assessment really drives treatment. It allows us to understand that individual's unique concerns and the best ways to support them.
Sometimes people just need to talk to someone in the moment. That's where a walk-in service has been particularly helpful, designed for those moments when a single focused session can make all the difference. These are 30-minute sessions, no cost, no appointment. Now, for other clients, their concerns might need a little more than a single session. That's where our brief intervention service has made a difference. This involves 6 focused sessions grounded in evidence-based strategies, but always adapted to each person's context. And of course, there are times when life struggles need a little more attention. That's where a long-term therapy service can be helpful for those more complex challenges. There's no one-size-fits-all. What matters is finding the right approach for the right person at the right time.
I want to focus in on the youth mental health context and describe how these two different domains work. One thing that makes our clinic really unique is that we understand the extent to which children are influenced by their environment. So, whether it's assessment or intervention, we make sure to include individuals within a child's community when we're providing them with support. At the UBCO clinic, we believe in care across systems. We understand that the family is a system. When one part changes, the whole system changes.
The chronic pain service is one of our specialized services here at the clinic, and we provide evidence-based intervention to folks living in our community who are living with chronic pain. We know that about 1 in 5 Canadians live with chronic pain, and that it's one of the leading causes of disability in our country. Pain can impact every aspect of someone's life, ranging from mental health, relationships with others, and can be very impactful. So when someone comes into our clinic, we're not just treating the physical experience of the pain, but the impact that pain has had across every facet of life. Access to support for chronic pain and the challenges that come with it continue to be a huge gap in our healthcare system. As future clinical psychologists, we play a vital role in providing understanding, connection, and hope to those navigating pain.
I'm delighted to be here tonight to discuss and represent the connection between UBCO's clinical psychology program and the interior health psychology service. Now, I'm able to do that because I hold positions with both organizations, but also because, as you've heard, I did graduate from the UBCO clinical psychology program. I've had the privilege of hiring 3 psychologists in the past 3 years. All 3 of them have been affiliated with the UBCO clinical psychology program. So at present, we have 5 practicum placements available. External practicum training allows for students to work with new client populations, the experience of actually working in public health to get a feel for what that's like, and to learn about the community programs that they're often referring to or suggesting to clients. It's also a critically important part of our job that we go on to continue to research as part of our public health roles. This research has been presented at national and international conferences. It's been published in peer-reviewed manuscripts. And so all of that learning that gets shared outwards also gets shared inwards.
I am so proud to announce that in the past 10 years since we opened the doors, we have had 10,000 visits to people in this community, in this province, that are in desperate need for assessment and treatment intervention. The reality is our ability to serve the community is directly tied to how many students and faculty we can support in the program. Currently, our acceptance rate in the doctoral program is 4%. For every 150 students that apply, we can accept only 6. We would love to expand this program, not just the doctoral program, but if you haven't figured it out, we kind of have big visions here at UBCO. We want to start a residency, focuses on Love it. On integrated primary care, indigenous health, and training in virtual real-time service like people do for physical health conditions, but training for it with psychologists. This would not be the first of its kind in the province. It'd be the first of its kind in the country. And we can do it.